Thank you all for joining us today. Today we'll be talking about the features within ClearTriage that support the handoff from nurse triage to a telemedicine visit within your practice or clinic or hospital. So we'll be looking through some different options there. Starting out, looking at today, just elaborating on that a little bit more and just making sure to lay the groundwork so that everyone understands. ClearTriage is a decision support tool for your telephone triage nurses. So it helps your telephone triage nurses with dealing with the phone calls that are coming in. It uses the Schmidt-Thompson telephone triage protocols, and those protocols direct the callers or the patients to either the ED, into an office or a clinic, or recommends that they stay at home. The challenge is in today's pandemic environment that many, but not all of those calls that would be referred to going to the office or going to the clinic are being seen by telemedicine, by a video visit instead. And we all need to realize that this will continue to happen to some degree, even after the pandemic ends, even though there will be more in-person visits at that time. So today, we're going to look at the different options that ClearTriage provides for your triage nurses to support them in that referral from the telephone triage phone call to a video visit, typically with a provider. Just to clarify, ClearTriage does not offer video visits for the nurse talking with the caller. That is not what we will be reviewing today. Instead, that recommendation from the phone call to a subsequent video visit. There really are three options that you can take advantage of within ClearTriage. The first is probably what you're doing right now, just letting your nurses decide. They can decide which calls they want to schedule as a video visit. You can add a little bit more to the documentation by adding an override disposition to let the nurse quickly within that call capture the choice to send that to a video visit. And I'll use the term video visit just somewhat interchangeably with a telemedicine visit, but just really to emphasize that it is that live audiovisual communication that the patient would have with the provider. So that's one set of options. The second set of options is there's a new account option within ClearTriage called Encourage Video Visits. You can turn that on, and that will change the names of many of the dispositions and set the options to encourage the nurse to recommend a video visit there. And optionally, you can mark specific questions as not eligible, ones that maybe require a procedure in the office. So we'll take a look at how that works. And finally, you can choose to mark specific questions as video visit eligible rather than the broader option within that Encourage Video Visits option. So we'll take a look at that as well. So I'm going to start out the simple way of just letting your nurse make the decision of what they think should be seen by a video visit. So let's just start with a call here. Mom called. Sarah has rash on her arm. It's extremely itchy. So I can come down here. I can find the rash localized protocol. I can select that. I can go through triage Sarah, and let's say that I get to, I get down here and I have a localized rash. Oops, sorry, I'm in the wrong protocol. I want the pediatric one. Come down here and I get to the question where there is severe itching, so she needs to be seen today in the office. The nurse can finish that call, copy that. I'm just going to use this generic form here as a substitute for your EMRs. And if I paste that, I have the note, and the nurse can just change it at this point in time to see by video visit, and then save it in your chart. So that's not changing anything in ClearTriage. It's just giving that authority, using your nurse's skill and judgment to make the decision about what should be seen by a video visit. The next step to make that a little bit easier for nurses would be to add a disposition. So if I come here to customization and then sign in as an admin user, I can go to the dispositions and add a disposition, see by video visit, and I'll make sure that this always show in the override list is checked. And I'll show you what that means. I'll save that. If you do use both pediatric and adult protocols, keep in mind the disposition sets are different. For instance, adult has labor and delivery dispositions. So I would need to also add this to the adult protocol set. See by video visit. So I've added those dispositions. I'll go back to ClearTriage. And so now the same thing, called Sarah with rash. I'll find that rash localized, click on that. Say I wind up at the same place, but now the nurse can just choose to override the disposition. And I can override to see by video visit. And the reason, you can choose whether you want to use that as a practice policy, whether it's nurse judgment, however you want to capture that. And I can save that. So that way, when the nurse copies and then comes over here and pastes in here, it already has, I use the protocol, here's the disposition it suggested, and I overrode that with see by video visit. So that's the first option that we talked about, and it's a simple way to let your nurse make the determination, or nurses make the determination of what they want to see by video, what should be seen by video visit. The next step past that is to use the new encourage video visit option. So let me come back here, and if I go again into my account settings, and down here at the bottom of the account settings is this telemedicine preference. Do you want your nurses to encourage the use of video visits? So you can choose yes here and save. And then when your nurses log in, two things will change. So let's just go ahead and do that same protocol. So we're looking at the same thing. Called Sarah with itchy rash. So I click that. What I have now is the titles of the disposition have changed to reflect really what you're probably doing these days. These questions here are go to office or see by video now. These questions here are see today in office or by video, and so on. So the titles are all changed except for the call 911 or the go to ED, because those questions still need to direct the patient right away to the ED, and home care, because those don't need to be seen by a video visit. But all of the ones in the middle, the ones that would send them to your office or clinic, now have video as part of that title. But more important, they also have this indication that this is video visit eligible. And when the nurse selects this, they are then prompted, did you offer a video visit? Because maybe there's some reason they don't want to offer that video visit. And if they do offer the video visit, did the patient accept the video visit? Because as we know, there are times that the caller will say, I don't have the bandwidth, I can't understand those apps, I'm not going to do a video visit. So I can do yes or no there. And then when I copy that call and paste that into my EMR, I have this additional line here that says a video visit was offered and the patient accepted. So that way you can be tracking what's going on with your nurses in terms of offering video visits and the patient making use of those. So that works well, but let's say, let me reset and let's go with something different. Let's say that Mark called, scraped his hand on rusty lawn edging. So I come here to skin injuries on the adult side. And if I look here, again, that same logic has been applied. So I have these middle disposition, not the ED or the home care, but the middle ones here are all saying, okay, see by video. But look at some of these down here. Like the last tetanus shot was more than 5 years ago or more than 10 years ago. So they might need a tetanus shot, which is indeed what that information is saying over here. So those don't make sense to be seen by video visit. I'm going to ignore the possible two-stage of seeing them by video visit and then referring them somewhere else for the tetanus shot. Let's say, no, I want to bring these into my practice or clinic. What I can do is I can mark these questions as an exception and say, I don't want these to come in by video visit. So I would go into customization again. And by the way, you can have one or more administrative users for your account. If you don't have those set up already, it will talk you through that. If you need to add additional ones, just email us and we will add those additional admin users. So in the protocols here, I can search for the skin injury adult protocol, and I can edit the questions. And so I can come down to those two questions. If I choose to edit the question with a pencil, I can say, no, those aren't video visit eligible. I don't want to see those by a video visit. So if I change those and then save this protocol and then go back to ClearTriage. So now if Mark has scraped his hand, skin, injury, I can click on that. And when I come down here, you'll see those two questions are not going to prompt the nurse to offer a video visit. So this lets you select the exceptions, ones where you have to visualize the ear, ones where there are sensitive questions, maybe child abuse or elder abuse suspected. Anything that you don't want to see by video visit is an exception. You can mark those questions. So you have this option that lets you make that broad change to reflect how you're doing business these days, and then go in and mark the exceptions so that you have consistent handling by all of your nurses and triage staff as far as what is referred to a video visit and what is not referred to a video visit. Let's talk about the third option, and it's related to, okay, what happens as the pandemic ends, as things start to settle down, or you start to see more patients within your office? You have two choices. You could go in and mark more and more questions as exceptions, or another way you can manage that, I come back in here to customization. And actually, I'll go to the account settings. Let me turn off the encourage video visit option. So now, oops. Now if I go in, let's again do that same, let's do like a ped sinus in. So let's say that we have sinus, pain and congestion on the ped side. So I look down here and maybe I see a few of these things that I want to see by a video visit. So not all of them. I don't want to have that option that everything here in the middle is being seen by video visit. I can go in to my customization again. And if I find that I customize protocol, find that peds, oops, sorry, sinus, pain or congestion on the ped side, edit those questions. And then maybe I come down here and I want to see, these pieces here, these questions with a video visit. But maybe I don't want to see the sore throat because that's going to lead to a strep test. And maybe I want to do a couple different of the questions down here, also to have my nurse offer a video visit for those. So the difference here is I'm picking up the specific questions that I do want to offer a video visit for, rather than with that broad option on, I was picking the exceptions. And it really depends what stage your organization is in, your practice or your clinic, and how many things you're seeing by video visit as far as which way is the most appropriate way to go. So now if I have mom calling about sinus pain, and I come here and go to those questions, I can see just the 4 that I marked are the ones where it has the indication to the nurse that, hey, these are video visit eligible, and it has that prompting for them when they click on it. Did you offer a video visit? Did they accept it? And again, all of that gets copied over and pasted into the note in the chart. So those are the 3 options that we have. One that you're probably doing now, just relying on the skill and judgment of your nurse to schedule a video visit. You may want to add in that override disposition. We have the new encourage video visits option. You can turn that on, and then you can mark specific questions as not eligible. So what you're getting there is you're getting that more active prompting of your nurse to offer the video visit. You're also recording, did they offer it? Was it accepted? And you can start getting real consistency by marking particular questions that you want to and don't want to have offer a video visit. Finally, if you're not using that broad option, you can still go in and mark specific questions as video visit eligible. Those are the different options. Appreciate your time. I appreciate your viewing this. We will post the recording for the webinar. If you have any questions, don't hesitate to get in touch with us, support@cleartriage.com, and we appreciate your time today. Thank you and have a great afternoon.